Good morning. Good morning, everybody. This is Bill Kennedy, and I welcome all of you to this morning's broadcast. The name of our program is entitled A Conversation About COVID-19, Diagnosis, Treatment, R&D, and Public Policy. On behalf of my partners and the staff at Nutter, I am pleased to host this morning's telephone conversation. I hope that everyone, all of you, your family, your friends, are all healthy and safe. Further, I remember in my thoughts all of those who have been infected by the virus. And I pray for those who are sick, and I pray for their recovery. And I extend all my sympathies to those people who have lost loved ones and friends, and just generally think of those who are having a difficult time during this pandemic crisis. And also I want to thank all of those people, first frontline people, doctors, nurses, but even hospital workers, technicians, grocery workers, everyone who has helped us survive this crisis. And again, I've also been heartened by the many stories of kindness that I've heard. I welcome those that are on the telephone. We do have a broad and diverse audience from healthcare and business and government and law, nonprofits, education, and real estate. So I welcome you all to join us, and we have a great number of folks from Nutter, and I thank you all for joining us. I also want to thank on the phone in case we don't have time at the end, Jay Wager and Colleen and Eber and Stephanie Goldstein of our staff at Nutter for putting all of this together. You folks who know me know that I am technologically challenged, so I needed their assistance. Also on the phone, I want to, before we begin, welcome J.D. Chesloff and Chris Cayley of the Mass Business Roundtable. I am a member of the board of the Roundtable, and I asked J.D. and Chris if they wanted to invite members of the Roundtable, and they agreed. So J.D. and Chris and members of the Roundtable who have joined us, welcome. Today's conversation, as I stated in my invitation, our political leaders, economists, business leaders, policymakers, and others all have seemed to agree that we must address our healthcare crisis before our economy will recover. And estimates for our recovery, as recently as Saturday's Globe, has been long and slow. And I've been on a number of calls by different associations I belong to with members of Congress and economists and business leaders, and they all say the same thing. We have to address the healthcare crisis, whether it's testing, whether it's contact tracing, and of course, ultimately, treatment and a vaccine. We have to get a handle on that. This morning, we have assembled an excellent panel from healthcare, life sciences, and government who are all engaged in some way on our response to COVID-19. And I thank each of them for being here with us this morning. First, I'd like each of you to say hello. The Secretary, Mary Lou Sutters, the Secretary of the Executive Office of Health and Human Services, and also Chair of the Commonwealth Command Center during this pandemic that was established by the governor. For you folks, just so you know, the Secretary's jurisdiction is over all health and social services, hospitals, mental health, public health, nursing homes, mass health, Medicaid, and it's over $24.1 billion that she oversees out of a $41 million budget and 22,000 state employees. I do want to thank the Secretary and thank the Governor and Lieutenant Governor and the command center and everybody involved on behalf of the state for the leadership and the dedication that you have shown all of us and demonstrated to us during this crisis. So Secretary Sutters, I extend that to you, and if you would pass that on to the governor, I'd be very grateful. Thank you all very much.
Of course.
And Secretary, I do just want to thank you particularly for a statement that you made last week during the press conference. I think it was Thursday. You recognized that May is Mental Health Month, and you spoke with great empathy for those people who have mental and behavioral health issues. We are all struggling in some way with the isolation and being out of our routine in some way. But those people who have mental and behavioral issues particularly, and your guidance to them, your advice was very much appreciated. So thank you very much. Our next panelist is, well, thank you, Secretary. Robert Coughlin. Bob Coughlin is the president and CEO of the Massachusetts Biotechnology Council, sort of a trade association of all life sciences companies. And their mission is to advance Massachusetts by leading in the life sciences, to grow the industry, add value to the healthcare system, and improve patients' lives. I first met Bob when he was elected a state representative over 20 years ago, and then he became the Assistant Secretary of Economic Affairs under Governor Patrick, and then became the Executive Director of Mass Biotech Council. And Bob has a personal mission as well. He and his wife have a son, now a young man, who was born with cystic fibrosis, and Bob and his wife and family have been so active all these years in raising funds to find a cure for CF. So welcome, Bob, and thank you very much.
Thanks for having me, Bill.
Welcome. Dr. Michael Collins. Good morning, Doctor. It's Dr. Collins is the Chancellor of the University of Massachusetts Medical School, and he oversees the UMass system-wide healthcare and life sciences portfolio. The University of Massachusetts Medical School in Worcester is the largest employer out there in Worcester. It's an outstanding medical school. Its revenues are over $900 million, and its life sciences research is over $250 million. They have a Nobel Prize winner, Dr. Mello, on the staff, and they're doing all kinds of cutting-edge research. I'm most familiar with their ALS research. I was involved with Dr. Collins a number of years ago with Governor Cellucci, who was treated there by Dr. Brown, and we engaged in some fundraising, and they just do a great job out there. And you're getting old when you remember when I was a student at Holy Cross across town between 72 and 76, the medical school was being built, and now, of course, it is flourishing. And Mike, I do want to thank you for graduating those medical students early, so they could be of service during this crisis, and also your work in the last several years on opioids and making that part of a critical part of doctors' training. Thank you, Mike. Welcome.
Nice to be with you, Billy. Thank you very much.
You're welcome. Attorney Kathy Williams is a partner at Nutter and the co-chair of the Life Science Group. Kathy represents early stage and established life sciences companies in the United States and Europe. Kathy has been with Nutter a little less than, I think, 2 years, Kathy. She has a significant practice. She hit the ground running, and she has become a valued member of the Nutter family. Thank you, Kathy, for joining us this morning.
Thanks, Bill. It's a pleasure to be here.
Welcome. My first question really is directed to Secretary Sutters. Secretary, if you could, I mentioned the daily briefings that you and the governor give, and Lieutenant Governor and others. Could you please, to the extent you can, give us a little bit of a briefing today on the various issues, the statistics, how the tracing program is going, the mask program, the testing. Just a brief status report of that would be much appreciated if you could do that.
Sure. And good morning, everybody. Bob Coughlin and I were on the phone earlier today, and I think we both think of this as one long day since the governor declared the emergency declaration on March 10th. And when I say that date, March 10th, it really does seem like it's been much longer than that. And I just want to thank Bill, and I want to thank everybody who's participating, because one of the things, having been sort of the governor's point person in the crisis response to COVID-19, is we have an extraordinary sense of community in Massachusetts. And it's, I have to say, there's no state I'd rather be in right now than in Massachusetts because of the strengths that we bring together. If I just give you a few data points, prior to February 28th, Massachusetts, we actually had no capacity to do testing for COVID-19 in the state. Any tests prior to then, we needed to send to the CDC in Atlanta, and it could take weeks before we'd get the test results. As of yesterday, so I'm giving you data that is current through yesterday, we have now performed about 314,646 tests, which is not where it needs to be, but it's obviously a significant improvement. Bruce Moll no longer asks the question of what is the goal in Massachusetts for testing. I remember when our initial goal was 3,500. We think that we need to be, our next reasonable goal would be around 25,000 people a day, with another goal of about 50,000 people a day as the important work around antibody testing and other things come to fruition and we roll out our tracing. Sadly, we have had 4,000 deaths in Massachusetts, just over 4,000, of a confirmed case number of 68,087. And we perform now between, it changes a little bit every day, but yesterday we reported about 15,000 tests. So we keep ramping up, and about 5% of our cases are hospitalized on any given day. So that just gives you like quick numbers. Of our confirmed cases, just about 58, or our deaths rather, just about 58% of our deaths are in long-term care facilities. And clearly, long-term care facilities and other congregate settings are hotspots for us, and we're doing a lot about that, and I'd be happy during questions to sort of go through that. In addition to ramping up testing, we obviously have been very hard at work with the hospital community in preparing for surge, and our hospital community is strong. We will not have a collapse of our hospital system at all, as we saw in other parts of the world. Stress in parts, yes, but the hospitals, I'm on a call with them every day. They actually have really prepared for this pandemic well. And again, I think that's one of the things that's a strength here in Massachusetts. So preparing for the surge in our hospitals has been a priority. Preparing for testing and continuing to expand testing. And for many of you who participated with that, thank you. And we still have to go instead. And standing up tracing. So on April 3rd, I guess it's just a month ago, we announced the partnership with Partners in Health, with our Department of Public Health and Accenture to stand up a statewide community tracing collaborative. So if someone is tested positive, that we support them in their isolation, and then we engage with their known contacts. It's also with the local boards of health, but really a statewide community tracing collaborative, so we can support people in their isolation and then really mitigate the spread of the virus on a going forward basis. It's live. We've been doing a soft launch, and it was clear that our local boards of health, because of all the other pressures, we needed to have more of a statewide response. And then the final statistic I will give you at this moment, because we live in data as you need, what we wanted to do, we have done, which is to not have this very peaky surge in Massachusetts. So the good news is we sort of flattened out the surge. The reality is it means that we've plateaued. We've plateaued for a while, and are just starting to see hopeful trends of decreasing. But let me end on that so other people can talk, and I'm happy to do questions and answers, Bill.
Okay, thank you very much for that status report of where we stand, and there's issues that are part of that will also be part of other questions as well. My first question, and we'll start with you, Secretary, is there are many aspects of COVID-19 that we do not know or understand, unlike some other viruses that we have. We have come to know, appreciate, and understand others, and even implement them, the social distancing, the contact tracing, the leveling the curve. These are all new concepts to us. And lastly, we continue not to know or have a good understanding the accuracy of testing, the question of immunity. I heard a doctor during the night on the radio, Dr. Gallo, who discovered the AIDS disease back in 1984, saying that we just don't know. He was asked a number of questions, and that was his answer, including, is it going to return in the fall? So when do you think there'll be effective therapies or vaccines to attack this virus? To use an often cited analogy, it's like we're flying the airplane while we're trying to fix it. How do we, government, business, life sciences, how do we address all these questions about this virus simultaneously as the learning process continues, and while we care for those who get the virus and also those that are impacted by it? So if Secretary Sutters, and then I'm going to reach to Bob Coughlin, and then Mike, and then Kathy Williams, if you could just address this question, which is intentionally broad, but so that each of you could have there's a part of it that I think is in your lane. And so what is understanding of the COVID today, and what strategies do we need to implement in order to attack it? Secretary Sutters?
So I will start. I'm happy to start, and then quickly turn it off to my friends in the life sciences and research. What I actually was thinking back to how little we actually knew in January in the United States around COVID-19 and our response to it. The rapid transmission of this virus and the early expansion of viral testing was very important. But as I think through, as I look forward towards the next 3, 6, 9, 12 months, year and a half, is we need to have really much more rapid testing available on the virus, much easier testing for consumers in terms of, spitting into the saliva testing, which would also then take off some pressures of the PPE that you need to then rapidly turn around in less than 24 hours so that you can engage then in rapid contact tracing in order to mitigate spread. Like that to me is the future of viral testing, of rapid testing, and then rapid contact tracing. At the same time, we need the antibody testing in terms of what is the immunity of this, what's been the reach of this virus, and what is the immunity and of and people's antibodies, and that really is that's where the strength of Massachusetts is on life sciences, and then obviously a vaccine. So we've done an okay job of stepping up viral testing, but we need to now really ramp it up much faster and much easier for consumers and take pressure off of the PPE challenges that many of us have and turn it around much more quickly. That's my quick as I look into the future, and that would prepare us for a second surge, viral and antibody testing. But let me turn it over more to the experts than the government official.
Thank you. Thank you, Secretary. Bob Coughlin?
Yeah, thank you, Bill, and thank you everybody for being on the call. I just want to start off by saying, this is an unprecedented situation, as we all know, and really the true heroes and leaders on this are, the folks that work with Dr. Collins, our frontline healthcare professionals, true heroes, and to Secretary Sutters as well. Her leadership in standing up the command center and the level of communication that has been taking place with the administration under the leadership of the governor has truly been extraordinary. And when I talk to my colleagues from all over the country who run other life science trade associations, they're truly envious of what we're able to do here in Massachusetts. So I wanted to say thank you for the leadership. I'm more proud than ever to be from Massachusetts. And when you look at this virus, right, it evolves daily. We do have a much, like the Secretary was alluding to, we didn't know much at the beginning, but we now have a pretty good understanding of how it spreads, how we can contain it, and how it can be tested. But there's a lot of issues with testing. We've done an amazing job communicating with the constituents, providing resources, and partnering with the private sector, and it's so important, but where we fall short is testing, and that's actually what the Secretary and I were talking about this morning, because we're not even close to be able to do widespread testing, and it's confined to those who are sick or exhibit symptoms. But it comes down to the supplies too. We're still low on supplies like swabs and other supplies and expertise needed to turn these results around quickly. And again, there's a lot of work on the antibody testing. There's still tests where you're seeing high false negatives or positives. There's still questions as to whether everyone who has recovered from the virus has the antibody, if they can be reinfected. I mean, these are things that we're still sorting out. And, but the reality is we won't have a true understanding of how this virus has spread until we're able to test more broadly. So it's so important that we continue the research and development of these diagnostic tests. And when you look at what's happening here in Massachusetts right now, we have over 70 companies here in Massachusetts that are working on either diagnostics, antivirals and therapies, and as well as vaccines. And we'll talk more about that, I'm sure. But it's amazing to see the partnerships between academia, meaning the academic medical centers, government, and our industry. It's truly what's going to get us through this, and I think we will be much more prepared in the future.
Thank you, Bob. Thank you very much for that answer. Thank you. Dr. Collins, Mike?
Well, thanks very much, Bill, and it's also nice to be with everybody. Let me echo the comments that Bob made about our state's leadership. I think that the governor and the secretary and lieutenant governor, all our colleagues there, are really they show Massachusetts proud, and I can tell you that being at a medical school that was able to graduate our students early so they could go to work, it really makes you very proud of being part of the noble profession of medicine. To your specific question, Bill, about what have we come to know, we actually know an extraordinary amount about the coronavirus. If you just think about it for a moment. If you look at trying to develop treatments or vaccines, in order to do that, you really have to understand the essence of the virus. And if you look at the attempt to look at the structure of the virus, to look at its genomic makeup, etc. In SARS, it took us 20 months to figure that out with the SARS virus, which was COVID-1. In H5N1 influenza, which was our last, big challenge, it took us 11 months. With H1N1 influenza, it took us 4 months. With Zika, it took us 3.25 months. With coronavirus, it took us 62 days. And that speaks volumes to worldwide research. When we ramped down our research labs, 19 of our labs went full-time on research on COVID, and are doing some fascinating studies about, as you mentioned, Dr. Mello won the Nobel Prize for RNA interference. One of our scientists now is looking at how a silencing RNA might actually prevent the virus from attacking the lung. One of the things that's interesting about the COVID virus, different from the influenza virus, when people get very sick with the influenza virus, it's typically because of a bacterial pneumonia that is superimposed on the viral illness. In this instance, the coronavirus actually attacks the lung tissue. And so in very short order now, in 62 days, we came to know the genetic sequence. And many people have, heard about the spike protein and the other proteins that exist within the membrane of the virus. And all those things are very important to come to understand, because they will become targets for drugs. And we heard a lot about remdesivir last week. It's one of the enzymes the virus needs in order to continue to grow is a thing called RNA replicase. And remdesivir, that drug that was tested last week, actually interferes with the RNA replicase. So it makes it difficult for the RNA virus to continue to replicate. So I think that we can take some solace in how fast we've come together and how much we now understand about this. That said, there's so much more to come to know. And as we go through the talk, Billy, I can talk more about that. But coronaviruses have been around for a long time, and the common cold is caused by an alpha coronavirus, croup and bronchiolitis. Many of our children have had croup and bronchiolitis. That's caused by an alpha coronavirus. A beta coronavirus is now broken into 3 different lineages, and they cause common cold and pneumonia. So we've come to understand quite a bit about them. And now our challenge is to develop agents, treatment regimens, and a vaccine to prevent it from from continuing to live.
What is the key unknown going forward, Doctor?
Well, I think there are a number of unknowns. I think to come to some of the points that Bob made with antibody testing. So let's just look at testing for a minute. So testing is very important, as the Secretary has made known, and we're going to need testing in order to bring people back to work. But this is kind of how we're thinking about it here. So we have the rapid test that's now available. So those tests can determine whether or not the person has the disease today. So as we're thinking about bringing our research back to work, one of the things we're going to do is test everybody on the day they come back to work. And that's good for that day. We know that day they had it or they didn't have it. And again, to the Secretary's point, if they test positive, then we will trace those people. And we have an entity within the medical school, Commonwealth Medicine, and Commonwealth Medicine now has been developing the capability to be able to do contact tracing. So that will be important. At the same time, we'll do antibody testing. And you see around the country now, antibody testing is being done to give us an appreciation for what percentage of the population might have antibodies to the virus. So when you get the virus is an antigen. The body creates antibodies. Those are the substances that fight the antigen, and they build up in the body. And within 2 to 4 weeks of your getting coronavirus, your antibodies should turn positive. First, IgM antibody turns positive, then IgG antibody. Now, when you say, what are some of the unknowns? Well, one of the unknowns is if we find that you had antibodies, we're going to have to be sure that the antibodies were to COVID-2. And so that gets some to the sensitivity of the test. As I mentioned earlier, there are multiple coronaviruses. And many who have been to China in the past, where many coronaviruses live, we've become exposed to those. And so the specificity of the test is very important to know. The second thing that's unknown at the moment, we believe, just like with the flu, that when you get the flu, you don't get that flu again that winter. But the virus is smart, and it kind of changes a little bit, which is why you can get it the next winter. So what we know now is that we anticipate that if we build up antibodies to the virus, that we wouldn't get it right away, but we don't know how long that immunity will last, nor do we know whether the virus will be smart enough to mutate a little bit. And just like the flu comes back the next season, when we come back with a second wave, will it be a little bit different? These are unknowns at the moment. And then the third thing we don't know is what the best route will be to create a vaccine. And so, as you know, there are about 90 different projects right now around the world to create vaccines. And Dr. Fauci talks about shots on goal. The point being, we need multiple attempts to create vaccines because we're not exactly sure which vaccine, whether it's the one that deals with viral particles, or it's one that deals with an attenuated protein, or one that deals with one of the elements that we know about the virus. Which one will be the appropriate one to stop the virus from infecting us?
Thank you. Thanks a lot for that very detailed and informative answer. Thank you very much, Doctor. Kathy Williams, could you please respond from the point of view of your practice and your clients and what is happening in that world, please?
Yes, and thank you, Dr. Collins. That was very, very interesting and informative. So I work with many clients who develop therapeutics, diagnostics, and vaccines, and both in Europe and the U.S. And I have looked across the information that's available, and as of Friday, there were 358 therapeutics and vaccines that are currently being tested. 199 of those in clinical trials and 159 in preclinical. That was reported by BioCentury, and they have a free COVID-19 resource center, biocentury.com/coronavirus, and it contains information like this. It's updated daily. And this is just an example of the astounding amount of research and attention that is being devoted to COVID-19. You may remember that for both SARS and MERS, which of course had much lower infection numbers globally, we still don't have specific therapeutics to treat and cure those viral infections. So there is a lot of hope that with the amount of resources that is being provided for the virus, that we will come much faster to both treatments and vaccines.
Thank you, Kathy. Thank you very much. Thanks for sharing that with us. The next question, I had questions 2 and 3 were somewhat related. I might join them together and start with Bob Coughlin. And that is the issue of research. There have been a lot of articles and stories about the research that is going on. I put this question together last Wednesday, and of course, since Wednesday, remdesivir, which everyone's mentioned, has now been approved under the emergency powers of the FDA and given to very gravely ill patients, and that reduces the recovery time for patients from this illness. So there is much going on. I had an article in the Globe: the race for a vaccine to combat the coronavirus is moving faster than researchers and drug makers expected. The timetable for testing and vaccines could be ready for emergency use in the fall. And again, it does talk about the FDA using its emergency powers to approve vaccines, which it did for remdesivir on Friday. And my question was going to be the status of testing and research for treatment and vaccines. And I know you've all touched on that. And then, of course, also last Wednesday, there was an article in the journal about scientists to stop COVID-19. And in Boston, and around the country, but it started in Boston, there are some investors and some doctors, all expert doctors led by a young doctor, that has put together a report, 17 pages, to give to the Trump administration. They believe they have the cure. And this is modeled after the Manhattan Project in World War II, where scientists got together to create the atomic bomb. So I do kind of want to merge these two questions together for the interest of time and focus. So on the research end of the vaccines, how do you see that progressing? And particularly on the approach, one approach being a group of wealthy investors. The headline is billionaires and scientists joined together. And how do you think this approach may or not be more effective than normal research in the labs by companies? And are there any dangers or risks in that? Bob Coughlin, could you please start that for us? I merged questions 2 and 3 together for time. Thanks.
Yeah, so no, thanks, Billy. And the way I look at it, I never thought that I would be on a panel talking about the fact that the most important thing to the world's economy and our public health is a vaccine. Like, I didn't expect that, right? That being said, when you look at the response from industry to this pandemic, it's been so incredible. It reminds everybody who works in this industry that how important their job is. Like, daily prior to this, everybody would go to work to solve unmet medical needs. But now with this all hands on deck approach, and keep in mind, you know, my experience and what brought me to this industry was the fact that I wanted to work with companies and really smart people to develop a therapy that would keep my son with cystic fibrosis alive. That took 18 years and close to $13 billion to invent a drug that is now currently keeping my 18-year-old son alive. And to think that, and you talk about the record speed that Dr. Collins was talking about to understand what this virus really means, to see all these companies partner and collaborate is so refreshing. It is so refreshing to see the fact that the FDA has loosened and adapted certain requirements to allow for faster approvals. This is for both tests and, you know, the antivirals as well as vaccines. And when I say loosen, nobody's doing it in a way that would ever compromise, you know, safety first, but we really, really, really need to work together to solve this problem. You know, traditionally, it takes upwards of 10 years and billions of dollars to invent a drug. How are we going to do this in the timeline that we need to do it? Well, we need to do it differently. We need to do it better, faster. To see a lot of these small, medium, and large companies, like I said earlier, over 70 companies here in Massachusetts are working to develop, whether it's a diagnostic, a treatment, and ultimately a vaccine for this pandemic. they have to share information. It isn't about making money. Nothing drives me more crazy when you see a tweet saying, oh, this is just another way for big pharma to make more money. It is not. If you look at, the financials behind what a company like Gilead will do with remdesivir, it's not about revenue associated with it. It's about doing the right thing. And to see so many folks in our industry working to get together to expedite access for this is truly amazing. And again, I need to not only applaud local leadership here in Massachusetts, but our federal leadership, as well as the FDA's action. In a time of public health crisis like this, we need to expedite approvals. We need to keep people safe. We need to keep people from dying. We need to do whatever it takes to get people back to work. And I think with the critical mass of the life sciences expertise and the healthcare expertise and the scientific expertise working with government as our partner, I think here in Massachusetts, we're going to position ourselves to pull ourselves out of this quickly. It's what we're good at. We know what we need to do, and we're going to continue to do it.
Bob, I have two things. The average time is, you said 10 years. One study says 10.71 years is a typical average to get a drug approved. Bob, have you engaged at all with any of the representatives of the scientists to stop COVID-19 or any of the financial backers of that? And it did say in that article last week that they do not expect to make a profit. But have you engaged in, is that another way through this small specialized group that possibly we could be successful?
Yeah, I haven't talked to any of those specific scientists, but I have talked to many of the companies that are working along those ideas. I have talked to some of the finance folks that have been coordinating efforts with them. But I think it's important to say that there's a lot of groups like that you haven't read about in the newspaper. And the more the merrier. The more people that sign up to be part of this solution, the better chance we have of doing this. They're doing this quickly. The collaborations across the country, and it's the way. It's going to be a different way of how we make drugs going forward. I think some of the bright spots that come out of this are going to be that we're going to put more of a priority on. I think all the experts on this call realize that we probably haven't paid enough attention to not only vaccines but also antibiotics. And the revenue model and the incentive models around private sector focusing on these areas just isn't good. And I think we need to focus on that moving forward. But again, I think some of these efficiencies that you see from these groups, Billy, will make us better at how we do things moving forward. It shouldn't take 10.7 years to do this work. There's got to be better ways to do it.
Thank you very much for that great answer. Dr. Collins?
Well, I think that the plan that's been put forward by the scientists to stop COVID is very thoughtful. It's very reasonable. It starts by saying we should look at drugs that currently exist. Remdesivir is a good example of one that was created for Ebola, but might have an effect on an RNA replicase. We should look at drugs like that and try to get them, repurposed, if you will, immediately to help us stem the course of the illness. And as you pointed out, the early findings in remdesivir are helpful, but it's certainly not. This is not the cure. What it does is it makes you go from having 15 days of illness to 11, and it reduces deaths from 11% to 8.6%. So that is a 30% improvement in days of illness, but it's certainly it's not it's not a panacea. Then the second point is we need to have antibody therapies, and that's also very thoughtful. Once we know what the antibodies are, perhaps we could create those, and they could become agents that we would use to ameliorate the disease. And as you know, we have a big study going here at UMass, and among other places, looking at the use of convalescent serum, which actually takes antibodies from a patient who's had the disease and gets the plasma of those patients and then infuses that into patients who are very sick, and that's being studied now at the moment. And the third wave would be to have vaccines. Again, another very thoughtful approach. The one thing that I would say about the vaccines, I think there's become a bit too much focus on the timing and not enough focus on the fact that we got to get it right. And I know that everybody is impatient, but when it comes to taking care of a human being, we've got to get it right. And we can't have vaccines that are going to, the vaccine it's got to work. B, it can't have a lot of side effects. And, the minute someone gets Guillain-Barré syndrome or syndrome like you have when you get the flu vaccine, the minute that comes out, it could set back a vaccine forever if there are a lot of side effects from the vaccine. So I think that while I'm hopeful we'll have something in 12 to 18 months, it's not that it's not that people are going slowly, is that that's what it takes to get it right. And that's going to be the most important part of having a vaccine. I think there's one other thing that we have to think about it, is that one of the things we're going to have to do in the world to solve this problem is we're going to have to vaccinate everybody. It won't be good enough just to vaccinate the 7 million people in Massachusetts or the 330 million people in the United States, because we've seen that irrespective of how it got there, we see how a virus could come from some other continent on the globe and have its most major impact on the United States. We're living that at the moment. So as we go to the future, we're going to have to vaccinate the world. And just think about the complexities of that. There was a very interesting piece I read over the weekend that just talked about the amount of glass that will be necessary to put the vaccine in a bottle to get it to where it needs to go. And if you think of that challenge, just the amount of glass that's going to be necessary. And then another point that lots of people have been making is the minute we get a signal that a vaccine might work, we can't wait to prove it. So we may have to spend billions making it and then come to find out it doesn't work. And we will have spent that money for no reason because we eventually come to the conclusion it doesn't work. So it's not as simple as just saying, we got to go fast, we got to go fast. Everybody knows we got to go as fast as we possibly can. But when it comes to actually then taking it out of the bottle and putting it into the patient, we have to be darn sure it's right.
Mike, are you saying that the vaccines, like ones we get at birth, or that this has become one of those kind of vaccines that upon birth a child is given a shot like we have today?
Well, ideally, Bill, we would have a universal vaccine against the coronavirus so that it would never come back. Okay? But just think about that for a minute. We yet to have a vaccine so that influenza doesn't come back. We know we have a vaccine that right now we've been looking in the southern hemispheres to see what was there last winter, and that's what our vaccine will be for this winter. But if you think about that, you have to have a vaccine every winter. Now, if this virus is smart like the flu virus and it starts to change its conformation a little bit or make it a little bit different, the vaccine may not work. So ideally, we have a universal vaccine that just like you say, you take it once and you'll never get it. But the vaccine is smart. And to the point that Bob made a few minutes ago, just think about that investment for a minute. Imagine, we have a team here, by the way, that works on influenza and creating a universal vaccine for influenza. Bob Finberg, our chair of medicine, leads that group. He immediately moved into COVID when the challenges came. But he's been working for a career to create a universal influenza vaccine, and we've yet to be able to do that. So I think that people should realize that as much as we want to do it, it's not as easy as snapping our fingers or having leaders come out and say, we got to get it done. We've got to get it right. That's going to be the most important thing. And by the way, we're probably going to need more than one, because just one is it may not be good enough. And if you think of the anti-vaxxers that are out there in the world, inevitably there'll be some side effects to this, and we'll immediately hear about it. So and so died, or so how many people got this, and that could set the movement back, for a long period of time. Which is why I come back to the point: it's most important that we get it right.
Well,
Thank you for that.
to that point, Dr. Collins, I'll also add that fortunately we have the Gates Foundation stepping up to get involved in funding vaccine manufacturing, which is no small thing considering 7 billion doses are needed just to give each person one dose. And that speaks to the importance of WHO being involved also, because Gates and WHO, and along with CEPI, the Coalition for Epidemic Preparedness, they are getting together to fund about a dozen COVID-19 vaccine development programs, knowing very well that they are very likely putting a lot of money into vaccines that don't work, but hoping that one of them does work so that we can get to the point where we have enough to give everybody globally a vaccine.
Yes, that's very important. And I'll just offer one other thought. We've spent something like $6 or $7 trillion right now on this problem, the pandemic, the problem the pandemic has caused to the country. We're going to have to spend billions on science in order to get out of this mess. And heretofore, that's been a fight year after year after year after year. And this can't be a fight any longer. Exactly as Bob says, we need to come together, we need to collaborate together, and we need to find a cure for this. And we need to pay attention to the importance of this problem for the globe.
Secretary Sutters, as you interact and listen to the folks in the life sciences field, as a state official, how do you see the research and the studies going forward?
So I would echo a little bit of what the chancellor said. Is while there is extraordinary, there's impatience for us to have a vaccine. It is important that while we accelerate the research and the science, that it has to be accurate and safe. A vaccine that's rushed to market, which I know is not the goal, would have significant negative consequences for individuals and for the confidence in vaccines. That's one. Two is, again, I think this is where, and I echo sort of what Bob said, it has been extraordinary, the coming together of the life sciences, research, academia, and folks from the business community with what I would call as an all-out war on this pandemic in altruism. I'm certain there are going to be people who make money off this, but really it is around grappling with a pandemic and the economic consequences of it. So that is probably the only thing I would contribute to this. I am similar to the chancellor. It's just like on the conversations about reopening the Commonwealth of Massachusetts, we want to do this right and safely and have people trust us, whether it's government, research, science, life sciences, and the rest.
Thank you very much. Thank you. I know the Commonwealth, of course, responsible for the public health of its citizens. So certainly your secretariat will be engaged in that. And the article in the Times also said that the scientists did reach out to the governor. So the Commonwealth is engaged in some way, at least being informed of what they're doing. So thank you very much for that. We probably have time for one more question from each, and so the question I want to ask is, the COVID-19 crisis has caused many of us to really question the kind of the future. What is our life going to be like after we get a handle on this? Even the governor the other day, talking about masks, said essentially what he said was get used to it, and socially what our life is going to be like. A friend was on the call called me the other day and says, Bill, there's not enough talk about being hopeful about the future and so forth. So I guess my question is, will we be able to control COVID-19 in some way? Will we be able to control it? Or will COVID-19 control us in our lives? And we'll start with Dr. Collins.
Thanks, Bill. I have a few thoughts I give you on that quickly. One, the virus needs us to live. The virus needs us to live. If it doesn't get passed from person to person, it dies. So all this social distancing measures that we've been putting in place have been to thwart the ability of the virus to do its thing. The virus isn't smart enough to get from person to person. We need to help it. So to the extent we have contempt for our leaders' warnings or our leaders' guidelines, the virus loves that contempt. To the extent that we ignore and we just say, I don't care, a lot of people are going to die, so what? We allow the virus to continue to keep going. And until we get to that point where we actually have a vaccine that can stop it, the virus will win if the people don't act smart enough. That's point one. Point two. One thing that I would ask people to consider about their behavior. In many instances, I've heard people say, people die from automobile accidents, 40,000 people die every year, we still make cars. Well, let me put it this way. If you decide you want to drink and drive and you hit a tree and you come into the emergency room, my colleagues will not be hurt by taking care of you. But if you act inappropriately and you get COVID and you have to come to the hospital, my colleagues are at risk. And I just like people to think about that for a little bit, because what we've had to do is we've had to actually act selflessly in order to prevent this. Now look, there's nobody that wants to get back more than me. But the virus needs us. Lastly, I do have great hope, Bill. We'll beat it. No question in my mind, we'll beat it. I don't know if it'll be 12 or 18 months, but we'll beat it. We will get it. We're smart enough to figure it out. We're smart enough to get a vaccine. We're smart enough to do it. But here's I think will be the defining moment for humanity. And that is, will we be global citizens around this disease? Will we act as one and say that the young child in the middle of Africa, preventing the disease for that one child is as important as curing the disease for the person that lives on the west side of Worcester? And that is really going to define us as humankind. It is within our ability to do it, but will we have the will, the resources? Can we collaborate together? And in so doing, can we put the virus in its place?
Thank you, Doc. Thanks for the very powerful answer in message. Thank you. Kathy?
I don't think I can do any better than that. That was very well spoken.
Thank you, Kathy. Secretary Sutters? Secretary Sutters? She may have.
I have every confidence. Yes. Hi. Can you hear me?
Yes. Thank you. Yes.
Can you hear me?
Yes.
Okay. I'm sorry. I have every confidence that we will prevail on COVID-19, and we are very resilient. I do think it will, and it goes to two comments of the chancellor. One is, I do think it is that it will be a bit of a new normal around social distancing for a while, around all of the measures, many of the measures we put in place. So it's not going to be an instantaneous back to life pre the pandemic. Certainly not until we have a vaccine. And I think for me, it is hopefully a defining moment for all of us of that we are a global community. I say it a different way when I'm at home, which is this pandemic really reminds me of how small the world really is. But if I think of it in a more positive way, that it is that we are a global community, and that our work around issues such as these kinds of viruses really requires a collective global response and not just an individual country response. And I think that is one of the takeaways that I have from this pandemic. And I hope when we are on the other side of this pandemic, we don't lose some of those extraordinarily important lessons.
Thank you for sharing that with us, Secretary. Thank you very much. Bob Coughlin?
Hey, I couldn't agree with folks more. And you know, the way I look at it is life going to be different for a while? Yeah, it sure is. And I know for my family, living in a household with an underlying health condition like cystic fibrosis, we're going to be very, very careful. I can't wait until there are really good antivirals or antibody treatments available prior to a vaccine, because that gives us a little more sense of security in the event that someone does become infected. But, you know, to think that we'll be back to normal overnight, it's not a realistic thought. But I think as a society, and like Dr. Collins was saying, and Secretary Sutters, we're going to beat this. It's just going to be a matter of time, and we are going to outsmart it, and we will defeat the virus. And I think not only I'm hopeful that we're going to be world leaders here in the U.S., I think right here in Massachusetts, we're going to be not only United States leaders, but as well as international and world leaders, you know, but with that critical mass of really smart people and academia, industry, and government working together. I think we can set the bar for the world, and I'm optimistically hopeful that we will.
Well, again, Bob, thank you for sharing your view on that and the optimism. I know that you are an optimistic person, knowing you for many years, and thank you for sharing that with us. It's a bit after 11 a.m. and we're going to end at 11. And this conversation is fascinating. It's just what I had hoped for and envisioned when I sort of put the idea for this conversation and convening Dr. Collins and Bob Coughlin and Secretary Sutters and Kathy Williams. And I hope, and I thank those folks on the phone who have joined us today. And I thank each of our panelists. And we are so fortunate to have each of you here in the Commonwealth doing the work that you do. And so I want to thank you all for making this conversation so informative and so special. And I want to thank each of you for your kindness and friendship with me. Thank you all very much. And I want to say goodbye to everybody. Thanks.
Thank you, Bill.
Please remain safe and healthy. Thank you all very much.
Thank you.
Bye.
Bye.
Thank you.
Bye-bye.